going to be talking about epilepsy, what it is, why it's so important to know what causes it, and how to help if someone is having a seizure. So I myself had no idea what epilepsy is, and that was the main reason why I decided to talk about it, because I had zero knowledge about it, and nobody seems to talk about it actually around me. So epilepsy, contrary to a popular belief, is very common. More than 3 million people in the US have it, and it's the fourth most popular neurological disease after dementia, Alzheimer's, and strokes. So just the fact to remember is that I know a lot of people are very scared of Alzheimer's or dementia and are scared of it affecting them when they grow older, but epilepsy is also something that you need to be scared of because it affects a lot of people, much more than you would think. So today I'm going to talk about what epilepsy is, what causes it, and I'm going to show you a plan of what to do if someone is having a seizure and how to remain calm in that situation. So first things first, epilepsy is a brain disorder that causes repeated seizures. Seizures can last from a couple of seconds to minutes or sometimes even hours. They vary from very limited motion jerks to full body convulsions. So they can be very different. They can be very scary looking. As someone who have never seen a seizure, if you see one, you will probably be very uncomfortable because it's normal and it's not something you see every day. So in this picture, this is an EEG. EEG is a medical exam you do when you suspect that a person has epilepsy. So it is done by placing electrodes on your scalp to record brain waves. And normal brain activity shows a regular pattern over here of waves and lines. And then if you have epilepsy, you can see abnormal spikes and sharp waves, as right here in the middle. This is recorded on someone who is not having a seizure at the moment, they just have epilepsy. And even if you are not having a seizure and you are doing an EEG exam, this is your brain. So the waves can be visible even if you're not having a seizure at the moment. There are two main causes of epilepsy. The first one is TBI, which goes for traumatic brain injury. So it can be a result of violence, of falls, of any other traumatic injury, car accidents. It can cause epilepsy. And then another one is genetic. So if someone in your family has epilepsy, you have a very high risk of getting it as well. And also the third cause, not a cause, let me put it this way, more than half of the cases of epilepsy doctors don't really know what causes it, so more than half of the causes are unidentifiable, let me put it this way. Now that we've discussed the most common causes of epilepsy, let me tell you about the warning signs of epileptic seizures. So the sensations very often feel like an incoming panic attack. A feeling of impending doom or fear overcomes the person. It feels like you are underwater and cannot form thoughts or sentences. It's a very scary feeling. From the outsider's perspective, it's easier to notice physical signs. So if someone isn't moving at all, or if they were still and then suddenly started moving, they might be having a seizure. Jerking movements of the body, changing in breathing, unresponsiveness, or again, very sudden bursts of activity sometimes can also indicate a seizure. After you notice the warning signs of epilepsy, it's very important to know what your next steps are. So the most important thing if someone is having a seizure is to stay calm. It's very hard to do, again, because seizures are scary and they can cause more panic within you than to the person who is actually having a seizure. Believe it or not, people who have seizures are very used to them. To them, it's a regular, it's a part of their everyday routine. So The most important thing for you to do is to stay calm. Contrary to popular belief, you don't need to put fingers in their mouth and make sure that they don't bite their tongues off. You actually don't really need to do anything. Don't restrain them. The most important thing to do is to let the seizure just follow its natural course and wait for it to finish. If you restrain a person in any manner, if you put your hands on them, other than putting them to the side, how it's shown here in the picture, you are very likely to trigger another seizure or to make it difficult for the person to kind of come to that natural conclusion themselves. So, next thing to do is you need to time the seizure. Now, if you know the person, if you know them personally, you will know that if it's their first seizure or not. If it's a stranger on the street, you have no idea. They most probably won't be able to answer you. So if the seizure lasts longer than 5 minutes, you need to call 911 immediately. You call them, tell them the address, usual stuff, and then you tell them that the person is having a seizure and it's lasting more than 5 minutes and that they need to come. Usually seizures last less, especially if it's not their first seizure, especially, again, if it's someone you know, it's easier for you to understand what is going on. But always time the seizure. Once it reaches 5 minutes, immediately call 911, and then make sure that to remain next to the person until 911 comes, and you basically save a life by doing that. You don't really need to do any extra things. Just remain next to the person and wait for help to come. So epilepsy is something that is not talked about very often. It's not something that is very well known. It's not something that people talk about very often. But these steps that we've discussed previously are something that can save a person's life, and you can help greatly if you know them. So, like I said in the beginning, epilepsy is the 4th most common neurological disease, and I feel like just like with Alzheimer's, the Parkinson's disease, strokes, dementia, you need to know everything about epilepsy because there is a risk that some of us will be having it once we grow older. So, there you go, that's it.
Okay, all right.